I'm Dr. Rastogi. I'm a psychiatrist specializing in anxiety disorders at the Northside West Clinic. Today I'm going to be talking about anxiety disorders. The first visit of seeing a psychiatrist usually is a long consultation lasting for about 45 to 60 minutes. This is the time where the history is taken in terms of your current symptoms, the cause of your current problems, your past history, if you've had any previous history of anxiety, a detailed childhood history, a family history, and a drug and alcohol history. These are the components of the history taking. After all that history, a diagnosis is arrived and a discussion is made of the possible outcomes for this diagnosis. So we talk about the different kinds of anxiety one may have and provide treatment. In terms of treatment, we offer a holistic treatment plan which includes talking therapies, doing some blood tests to rule out a medical cause, using medications occasionally. A crisis plan is very important because some of them may have negative thoughts and suicidal thoughts, and occasionally we would offer hospital admission if they have severe anxiety and they're functioning quite debilitated. Following the first visit, another appointment is offered within 4 to 6 weeks depending on the need and the severity of the anxiety. If you find yourself in a situation where people around you are having a panic attack or panic symptoms, these are certain steps that can help them to calm them down. The most important step is first to keep them safe, to move them to a safe place where it's less crowded and it's quiet. Get them to sit down, have a glass of water, or just breathe normally. Sometimes the paper bag strategy can be very good, to ask them to breathe in a paper bag or count their pulse, which actually helps them to slow their breathing. Cold water with ice can be very good. As you drink it slowly, the breathing settles down and they feel a little bit settled. Once they're settled enough to a stage where they can talk normally and the breathing's calmed down, then it is important that they get some medical help around that time. Anxiety can present as a separate entity or it can be a part of certain conditions. The common conditions in childhood, such as attention deficit disorders, present in adolescence with anxiety. About 60 to 80% of people with attention deficit disorder do present with some form of anxiety, which can be debilitating. And generally, that is masked by using recreational drugs to combat the anxiety symptoms. Other conditions such as head injury, if you have had a history of head injury, epilepsy, the vulnerability to anxiety disorders is very high, and it's very important to keep that in mind in treatment of anxiety because they're organic causes of anxiety and they need treatment simultaneously. Although anxiety can occur at any stage of your life, there are 3 peaks in a lifespan where anxiety is more prominent. The first peak is around adolescence because that is a very important transition to adulthood. The second peak occurs between the age of 30 to 35. In women, it's associated with parenthood. In men, it may be associated with stability and employment. And a third peak occurs at the age of 60 to 65 where you're transiting into retired life. These are the 3 vulnerable periods in a lifespan of a person where anxiety symptoms are the worst. And if you have a vulnerability or a predisposing factor, you're likely to have symptoms of an anxiety disorder more prominent around that time. There is ongoing anxiety and a new problem called smartphone addiction. This is very similar to addictive disorders. There is a condition called nemophobia, which is fear of losing your phone, and it is based on tolerance and the fear of withdrawal of not having your phone. This has quite significant implications in the future, especially working on social skills, decreasing self-esteem, and a higher risk of adolescent depression and anxiety, and a big burden to society in the next 2 decades. The take-home message for anxiety is, for anyone who's suffering from anxiety, is get help early. Early treatment has the best outcome. Have a good support group and a crisis plan. Be a part of a support group through your GP, psychologist, or through a group program. Take the treatment holistically. One or the other treatment does not help. Sometimes a combination of treatments such as talking therapies, medications, and lifestyle changes have a good outcome. Be aware of your warning signs and relapse prevention, and get help early in your relapse prevention.